If you're over 70 and your doctor just told you your blood pressure is finally perfect at 120 over 80, you may want to hear this before you celebrate. Because for many older adults, that number may not be as safe as you think. In fact, some newer research and clinical observations suggest that aggressively lowering blood pressure in seniors can sometimes create a different kind of danger, one that doesn't show up clearly during a routine office visit. We're talking about dizziness when standing, sudden weakness, falls, fractures, hospitalizations, and in some cases, a rapid loss of independence. And for older adults, one fall can change everything. In this video, we're going to break down what blood pressure may actually look like in healthy aging, why the ideal target for a 45-year-old may not always be the best target for a 75 or 85-year-old. What symptoms should never be ignored, and one simple at-home test that could reveal whether your blood pressure is dropping too low when you stand. If you've ever felt lightheaded getting out of bed, standing up from a chair, or walking to the bathroom at night, stay with me, because this information could be one of the most important things you hear all week. Here's the problem. In many clinics, blood pressure is treated like a simple numbers game. A patient comes in, the reading is 145 over 85, and immediately the goal becomes getting that number down, lower, lower, lower. For younger adults, that approach often makes sense. High blood pressure in midlife can damage blood vessels over time, increasing the risk of stroke, heart attack, kidney disease, and cognitive decline later on. But aging changes the equation. The body of a 78-year-old does not respond to blood pressure the same way the body of a 48-year-old does. And when we ignore that difference, the result can be dangerous. Because what looks perfect while sitting calmly in a doctor's office may become a serious problem the moment that same person stands up. Imagine this. A 79-year-old is taking one blood pressure medication. Their reading is a little high, so a second medication is added. 2 months later, the office reading looks excellent, 124 over 76. Everyone is pleased. But now, when that person gets up from the couch, they feel slightly off balance. When they stand up from bed in the middle of the night, the room spins for just a second. When they walk quickly after sitting for a while, they feel weak or unsteady. Those moments may seem minor, but in older adults, they can be warning signs that blood pressure is dropping too low when upright. And if that drop is large enough, the brain may not get enough blood flow fast enough. That's when a simple trip to the bathroom can turn into a devastating fall. This is why more experts are emphasizing something that doesn't get enough attention. Blood pressure management in older adults must be individualized. Not every senior should be pushed toward the same target. Not every person over 70 needs aggressive medication adjustments. And most importantly, the right blood pressure number is not just the one that looks good on paper. It's the one that protects the heart, the brain, the kidneys, and the person's ability to stand, walk, think clearly, and live independently. So why does this happen? Why can lower blood pressure become risky as we age? There are 3 big reasons. First, the arteries themselves change. Over time, blood vessels become stiffer and less elastic. Younger arteries expand and cushion the pressure wave each time the heart beats. Older arteries are less flexible. That means the body may require a slightly higher pressure to keep blood flowing effectively, especially to the brain when standing. Second, the body's built-in pressure sensors become slower. These are called baroreceptors, and their job is to detect when blood pressure drops and quickly trigger a response. In younger people, that response is fast and efficient. In older adults, it can be delayed. So when an older person stands up, the blood pressure may fall more than expected before the body can correct it. Third, medications can hit harder in later life. The kidneys and liver often process drugs more slowly with age. A dose that seems routine on paper can have a stronger or longer-lasting effect in an older adult, especially if they're taking multiple medications. This brings us to a crucial concept that every older adult should know: orthostatic hypotension. That simply means your blood pressure drops when you stand up, and this matters far more than most people realize. You can have a blood pressure reading that looks great while sitting down, but if it crashes the moment you stand up, you may be at increased risk for dizziness, falls, fainting, fatigue, brain fog, and even injury. This is one of the biggest blind spots in routine blood pressure care for seniors. Many people are treated based on seated readings only, while the symptoms that actually affect daily life are happening when they're moving, walking, standing, and living. The good news is there's a simple at-home check you can do. If you have a home blood pressure monitor, this takes just a few minutes. First, lie down and rest quietly for 5 minutes. Then, measure your blood pressure while lying down. Write down the top and bottom numbers. Next, stand up and measure it again as soon as you can, ideally within the first minute. Then, compare the readings. If the top number, the systolic pressure, drops by 20 points or more, or the bottom number, the diastolic pressure, drops by 10 points or more, that may be a sign of orthostatic hypotension. If you also feel dizzy, weak, or unsteady, that's even more important. This doesn't mean you should stop any medication on your own, but it does mean you should talk to your doctor and show them those numbers. This is exactly the kind of information that can change treatment decisions. Now let's talk about targets. This is where a lot of confusion happens. Many people have heard that everyone should aim for 120/80, but in real-world geriatric care, it's not always that simple. For many healthy adults in their 60s and early 70s, a systolic blood pressure, the top number, somewhere around the low 130s may be completely reasonable. For adults in their late 70s and 80s, especially if they're experiencing dizziness, frailty, balance issues, and multiple medications, a somewhat higher range may be safer and more realistic. Some clinicians may be comfortable with systolic readings in the mid-130s to low 140s, depending on the person's overall health, fall risk, kidney function, heart history, and daily functioning. That does not mean high blood pressure should be ignored. It means the goal is balance, not simply the lowest possible number. And that balance matters. Blood pressure that stays too high for too long can absolutely increase the risk of stroke and cardiovascular damage, but blood pressure that is pushed too low in a vulnerable older adult can increase the risk of falls, confusion, weakness, kidney stress, and reduced quality of life. In other words, both can be dangerous. The healthiest target is often the one that protects against long-term cardiovascular risk without creating short-term instability. That's why the right question is not how low can we get it. The right question is what range keeps this person safe, strong, clear-headed, and protected. Let's look at two 82-year-olds. The first is active, walks daily, has good balance, and no major medical problems. Their blood pressure is 152/84. For this person, reducing blood pressure may make sense, but slowly, carefully, and with close attention to symptoms. The second person is also 82, but they've had a recent fall, take several medications, have mild kidney disease, and sometimes feel dizzy when standing. Their blood pressure is also 152/84. Same age, same number, completely different situation. If both people are treated exactly the same way, one of them may be placed at unnecessary risk. This is why experienced clinicians often say, treat the patient, not just the number. There's another important point most people miss. One office reading does not tell the whole story. Blood pressure naturally changes throughout the day. It can rise with stress, pain, poor sleep, caffeine, or anxiety. It can drop after meals, after medications, or when standing. That's why home monitoring is so valuable. If you're over 70, keeping a blood pressure log for 1 to 2 weeks can give a much clearer picture than occasional clinic readings. Check it at roughly the same times each day, such as morning and evening. Sit quietly for 5 minutes first. Keep your feet flat on the floor. Use the same arm each time. And write down not just the numbers, but how you feel. Dizzy, tired, clear-headed, weak. Those symptoms matter just as much as the readings. If you're wondering why more people aren't talking about this, the answer is simple. Medical practice often changes slowly. Guidelines are built from large studies, and it takes time for newer evidence, especially in older populations, to influence day-to-day treatment habits. Many clinicians are doing their best under time pressure, and it's easy to default to standard targets instead of tailoring care. But as patients and families become more informed, better conversations can happen. You don't need to argue with your doctor, you just need to ask better questions. Here are some smart questions to bring to your next appointment if you're over 70 and on blood pressure medication. First, what blood pressure target makes sense for my age and my health, not just the standard guideline? Second, could my dizziness or fatigue be related to blood pressure dropping too low? Third, should we check my blood pressure sitting and standing? Fourth, do my medications need to be adjusted based on symptoms, not just the office reading? And fifth, would you like me to bring in a home blood pressure log for the next visit? These questions shift the conversation from a generic protocol to personalized care. And please hear this clearly, never stop or change blood pressure medication